Good morning.
Good morning.
I'm Neil Holton. This is the 2nd of May, 2014, and we're here as part of the Anoka County Historical Society's Oral History Project for Anoka State Hospital, and I'm talking with Dr. Ronald Killinen. Thank you for coming in.
Oh, you're welcome.
Could you tell us where you were born and where you went to school, where you grew up?
I was born in Duluth. I grew up there, went to UMD, and then went to med school in Minneapolis. And my residency was there with my last year residency in Connecticut.
Okay, and your residency was in what specialty?
Child psychiatry.
Okay. How did you choose that?
Almost by default. I was first going to go into pediatrics. And then when I did my internship at Minneapolis General, I found out so many of the pediatricians were really not happy with their specialty. So I had been, in my junior year, one of the staff in the psychiatry department had encouraged me to take a psych residency. And so I called him up and said, is the offer still open? And so I first was general psychiatry, and then I shifted to child psychiatry.
And could you put some dates on those? Medical school graduation?
Medical school, 1957, and then in '62, I had a brief career as a professor at Madison, Wisconsin, and then I came to Anoka in '64.
And was that your first professional position?
Well, the Madison one was my,
Okay.
I was an assistant professor there.
All right. And in the psychiatry department?
Yes.
And what led you to come back to Anoka?
Well, we wanted to move back to the Twin Cities area, and it seemed a little scary to go into private practice, and here was a salaried spot, and I thought I could, sort of latch out of that for a few years and then move from there.
So that was 1964?
Yes.
And how long did you stay at Anoka?
8 years. I was going to stay 2, and I stayed 8.
Prior to working at Anoka, did you know anything about the place?
Not really.
And how did you come to find out about it?
When we were exploring moving here, I started asking around, and somebody told me verbally that the hospital had gotten a NIH grant to start the adolescent program, and so here was grant money and a program there, and so we could start up.
Okay, we'll talk about some of the patients a little bit later.
Okay.
But could you describe what your duties were as a physician here?
Well, I essentially ran the adolescent unit and was the physician in charge and worked with the team there.
Was that a new program?
Yes, we started with the NIH grant, yeah.
And how long did that funding run?
It was only for 2 years, but it got us going.
Was that the intention, that it was to do a startup? Was the funding intended to do that?
Yes, the grant money had already been obtained when I came here, and so it was just like open and ready to go.
And did you start the program?
Yes.
And could you describe how you did that?
I had half a day to train the staff, and we started up. Because I first worked for a few months in the general hospital and solicited some people to, are you willing to come to the adolescent program? but our in-service training was a half a day.
Did people feel ready?
Probably not, but we went anyway.
And how long did this startup phase last before you were kind of in a normal mode?
We just went.
Okay. And how did you relate to the other medical staff?
Well, we had regular staff meetings. I was the secretary of the medical staff, which is I think that's the most powerful position in an organization, because you get to keep the notes.
And how many physicians were here?
I think about 6 or 8.
And did everyone have different roles and specialties?
I think everybody else was general psychiatry.
Okay. Were there any general practitioners or surgeons?
There was one retired general practitioner who had one of the cottages. Very competent fellow, by the way.
And was there a physician assigned to each of the cottages, or?
Yes.
And what would their daily work consist of?
They would see patients, run a team meeting, and generally kind of an overall supervisory position.
And what were some of the challenges of that?
Well, the huge number of patients that were here when I came, the numbers were well over 1,000, and they were just packed in. The bunks in the dorms were three high. They also had one of the most efficient way to get people showered. There was this, you went in one door, took off all your clothes, went down this shower stall with sprinkler heads, and at the other end you got a towel and some clean clothes. So they could do the whole job very efficiently. And that kept the cost way down.
How often did the patients shower?
I don't know.
How about their other conditions? Do you think the food, was that adequate?
Well, I think there was enough of it, but you know, when you're cooking for a large group, it's assembly line stuff.
Were any trainees assigned to you, like interns or medical students?
No.
Now, turning to the patients themselves, could you describe some of the diagnostic categories?
I would say by far and away the majority were behavior disorders, kids who were acting up and may not have made it in other programs. And so they came to Anoka. We tried real hard to make as much of a family atmosphere as possible. Possibly, I think I may have been swayed by that old movie, Goodbye, Mr. Chips. And we try to have, we had an annual party commemorating when we opened. We would shut the unit down for a couple of weeks, and everybody went up to a camp on Mille Lacs Lake. And so, you know, we tried to give a home-like atmosphere.
And what kind of treatments did you have?
It was mostly talking therapy. We had very little. I had very little use of medication. I always have been a little skeptical about that.
And if you did use medications, do you remember what they were?
Well, we had Thorazine, Malorel, Prolixin, but we didn't, very little use of the major psychotropics, and we didn't use any of the antidepressants.
Is Prolixin the injectable one?
It can be. It's either oral or injectable, yeah.
What percent of the patients in the adolescent unit were on medication, do you think?
Probably only 5%.
And how did the treatments work? Were they successful?
Well, I think we had several, some of our alumni were attorneys in town. One fellow went off to medical school. One fellow is still working at General Hospital as an orderly, very, very valued employee. He was an interesting boy because in the fall, he was at 15, he was reading at the 3rd grade level, and we finally worked out an arrangement where we were in charge and he accepted it. By March, he was reading on the 8th grade level. So we had our own on-ground school there.
Okay. And was there any coercion at all, or just you use rewards, or how did you change behavior?
I don't know. I think I try to present him with like a strong central figure that was kind of in charge, and I think the turning, and it was early in the career there. One evening, 3 of they were pretty big kids, decided they were going to barricade themselves in their room and see if they could set up a ruckus. And the police or fire department were called, and they called me, and I got there, and someone said, "How about can we use tear gas?" And I said, "Oh, sure." Because, well, they threw in a canister in that room, which is apparently enough for an entire apartment building, and it peeled the paint off the walls, and the place reeked tear gas for weeks after that. And what I did then the next morning was I packed up all 3 of them, shipped them down to the security hospital, and didn't let them come back until they were accepting that life. And from then on, things were pretty good.
Did you set up the treatment plans for the patients?
In combination with the staff, yeah.
And how did that work?
Well, we had a team meeting. We had a morning meeting every morning, and then we would discuss what was going on. And we had OT and physical therapy.
And nursing?
Yeah, nursing, yeah.
What did those treatment plans look like? I mean, were they written up that people could review?
They're not nowhere near as sophisticated as has evolved over the last, couple decades, but they were sort of a working understanding of what we were dealing with and how things. It was everybody. The idea was to get a relationship going with the various staff people.
And how did the patients react to these plans? Did they know there was a treatment plan for them?
Oh, I'm sure. We also had a weekly afternoon staffing in which we would review one patient at a time in greater depth, and we had all the staff and the patient there, and we would discuss how things were going.
And how did the patients react to that?
Oh, I think sometimes they didn't like the focus, but on the other hand, they were the center of attention.
Okay. Were there any disagreements or disputes about patient care?
Possibly, but I was kind of arbitrary, if not dictatorial.
How did you relate to the other professional people, like the occupational therapists?
Oh, I thought we got along real well.
And did you come up with joint plans to treat different patients with special?
Well, I think It was basically up to like in occupational therapy for a fellow named Spence. They were there for an assigned time, and he worked out with them what he wanted to do. I didn't tell him what to do.
Technically, I think they need orders from the doctor to treat the patients.
I'm not so, well, we just sort of like had the program, and it was understood that everybody would be part of it.
Now, could you talk about how these young people got to Anoka?
Everybody was a voluntary patient. When I came here, the attitude on the part of the psychiatrists in Minneapolis was they would hospitalize the kids until their insurance ran out, and then because it was very easy to commit people, they would then have them committed, and they would be driven up here and dumped. And I didn't accept that. I said, if you do that, there'll be patients in the general population, and we won't accept them into the program until we meet with the patient, meet with the family. We insisted that the family had to work with a unit social worker.
And did that go over well with your colleagues that were trying to send patients up here?
I never found out.
So did you?
Probably not, because this made life a little more difficult for them.
And did you talk with them about the care that the patients had already received?
No.
And how about diagnostic procedures? Did you use any testing or?
Yeah, we had a non-unit psychologist, in fact, 2 of them for a while.
And what would that entail?
They'd get an IQ test to begin with. Then they had MMPI and, if necessary, Rorschach and other psychological testing. But that was up to the discretion of the psychologist as what they wanted to do.
And so everyone got diagnoses?
Yes.
What was the most common? You said behavioral disorders, but?
Adjustment disorder of adolescence or conduct disorder.
Was that a standard diagnosis at that time?
Well, it was right out of the DSM,
Okay.
I think it was DSM-2 at that time, yeah.
And what kind of criteria would be involved in getting that diagnosis?
Well, the DSM manual did sketch out a description of the various types of diagnoses. So it was a question of sort of fitting them in.
Did you have any patients that were not behavioral disordered?
There were not many, a few that had schizophrenia.
And how did the patients get along with each other?
I would think, well, there were cliques, and there were, there was a hierarchy of who was, every large group, you get a hierarchy of status within the group.
And how big was the group?
Probably between 30 and 40. And we started with a boys unit, and then after that had been on for a year or 2, we then added a girls' adolescent unit.
And did they have interactions?
Oh yeah, they were in school and everything together, yeah.
What would you say was the biggest challenge in working with those patients?
The community of Anoka. There was tremendous animosity, maybe fear. And one of the employees on grounds had a husband who was in the police department. And so every rumor and there were lots of rumors, would instantly find its way into the town of Anoka. So.
And you think the general population of Anoka was afraid of the patients?
Somewhere.
And could they come and go, the patients?
Yep, we were not a locked unit. And we had maybe two went to high school in the Anoka High School building.
Were there any incidents at all with your patients going into town?
I remember one that never quite happened. For some reason, there was going to be this rumble, and there was a line of about 8 guys from Anoka marching 2 by 2 down the sidewalk. They were going to head their way into town, and I heard about it, and so I got in my car, and I pulled up and a little fast so that I had to slam on the brakes and squeal to a halt. And without saying a word, I opened the back door, and all 8 piled in the back seat. And I turned around, and they came back, and that was the end of that one.
Were there safety concerns for the staff or the patients?
Not really.
Any fighting or physical interaction?
Oh, occasionally, but it wasn't big. One day in particular, this one young man he was not going to school, and he was calmly playing pool and was just defying everybody. And so I said, we're going to have to take charge of him. Well, I couldn't get anybody to cooperate with me. So I went up to Jeff, who was playing pool. He was taller than I was. And I said, Jeff, I'm putting you in the quiet room. He said, you and who else? I said, no, just me. And everybody in the staff was watching, what's going on. And I put him in the quiet room, and he came in and sat on the floor, and he burst into tears and says, I don't want it this way. He ended up running a gas station in Minneapolis.
How long did the patients stay?
Some seemed like they stayed forever, but it was generally up to 2 years.
And what kind of criteria did you have for discharging?
Well, they had to be doing well in school. There had to be a plan for them. Excuse me. And then we had to also have things worked out. Where are they going to live? What's the deal with the family?
And how involved were the families?
Well, as I said, we had a unit social worker who met with practically everybody on a regular basis, probably every 1 or 2 weeks.
And were the families generally supportive?
Well, maybe we had to coerce them a little because we weren't going to take their kid unless they were cooperating to be part of the program.
And what was the age range of the patients that you had?
Oh, as young as 12, 13, up to 16, 17.
And do you remember any examples of behaviors that really led to them being committed? Was it criminal activity or
there was
disruption? Or?
Some were referred by juvenile court. There was fighting, not making it in other programs. Like we got several patients from Bar None Ranch that weren't doing well, and so we said, well, we'll give it a try.
And what do you think was different with the Anoka treatment that worked, where other places may not have been successful?
I really don't know. I could.
Okay. You've given several examples of people that went on to be quite successful. Mm-hmm. Could you tell when they were here that would happen? Could you predict?
I don't think we even had worked out any criteria for how could you make a prediction like that.
Mhm. Did you just have a sense of it?
Yeah, seat of the pants.
Did you interact with anyone in the other state hospitals? Peers?
Oh, we'd have occasional meetings. And there was a fellow down in the main office who was like our consultant. And I met with him on a regular basis.
In St. Paul?
Well, we generally meet for lunch somewhere between.
And what kinds of topics did you cover?
Oh, I think it covered the whole range of, from politics to, and then I used to meet with the overall director. But with him, I discovered what happened is sometimes you'd meet with him and agree on one thing, and then a month later, he'd say, don't you remember we talked about this and we're going to do this or that? So then what I started doing from then on was every time I met with him, I dictated a memo of what our meeting was about, what we decided, and sent him a copy. So he couldn't bamboozle us after that.
And what part of the government was he in?
He was the medical director of the Department of Welfare.
Okay. And a physician or not?
Yeah,
And what kind of specialty?
psychiatry.
Were you part of organized medicine at all?
No, did I ever join the AMA? No.
And how about the Anoka County?
Not Anoka County,
Group.
but Hennepin County Medical Society.
How do you think the general physician population viewed Anoka State Hospital?
I really don't know.
They were willing to refer their patients?
Well, they had to send them someplace. But basically, the general hospital was kind of a large, basically holding tank. I mean, when you have 1,600 patients, that's. I was acting medical director at Anoka on 2 or 3 occasions, and I can remember dictating. One fellow retired, and his closet in his office had a stack of about 200 charts that he had not finished up, and we were going to get reviewed by the accreditation committee. And I can remember dictating charts of someone who came into the hospital at age 18 and was now retiring from the hospital because they were eligible for Medicare and could go to a nursing home. Spent their whole lives here.
Were there a lot of those, or?
Quite a few. Because see, the hospital operated completely it was a very inexpensive operation. They raised all their own vegetables. They had a huge dairy herd. In fact, the dairy herd thing I think is funny. The farmer legislators criticized the hospital for how poorly they were running their barns. So then they made a decided effort to improve the quality of the herds, and then the hospital was making surplus milk, which they were selling on the market. So by the time I came, the dairy herd had been shut down. But they grew potatoes and rutabagas and had Brit cellars. And
Did you ever function as like a legal expert in any?
oh, I've testified in a few cases, yeah.
And what kind of examples?
Well, there was one fellow that he was probably kind of a borderline manic, who was aggressive and had done some small robberies. And I remember I testified on whether he was, because he was faking being crazy, and whether this was real or not. And he got sent off to jail. And when he came back, he stalked me for about 2 or 3 years, calling in the middle of the night saying, "You can run, but you can't hide." And finally, and this was when I lived in Golden Valley, he got exasperated with me, and he would never tell me his name. He said, "Well, who is he?" He wouldn't say, and so he went and called the cops. He was going to report me, and a sergeant spent a couple hours with him on the phone in the middle of the night and got his name and address. And he also had threatened the judge too. So the judges don't like that.
And what finally happened?
He settled down because I've never heard from him since.
When you were working at Anoka State Hospital, did you live nearby?
We lived mostly down in Hopkins, and then we sold that house, and with not another one lined up, we spent 3 months living in one of the staff houses that was about to be torn down. There was a row of staff houses on the Anoka end of town. We lived there for 3 months.
But you never really lived in Anoka?
No.
Okay. How long did you stay at Anoka State Hospital?
About 8 years.
And after leaving, what did you do?
I went into private practice in Minneapolis.
Okay. And how long did you do that?
It seemed like forever. I was solo for a long time, and then I joined the Minneapolis Psychiatric Institute and spent the last about 6 years at that, and that was at Abbott Northwestern Hospital.
Was your work similar to what you'd been doing at Anoka?
It was more typically a private practice, inpatient, outpatient, short-term focused treatment.
What do you think over time people's attitudes have been toward mentally ill people?
I think it's been pretty stable. There's probably a mixture of not understanding, fear and avoidance, and maybe a lot of folklore.
Did you ever interact with advocates for the mentally ill?
Yes, I was. I spent quite a few years on the steering committee for the Minnesota. It's a citizen group that.
Is it NAMI?
No, I don't remember. But yeah, I spent quite a few years at that.
And what would you contribute to those groups?
We just general discussion of advocacy and programs and what we could do from a PR standpoint.
And what kind of advice would you give them now?
Keep doing it.
Okay. Anything come to mind that we haven't covered?
No, I haven't been taking notes, so
Just one other question about your time at Minneapolis General Hospital. What was that training?
that was back in the days when we had internships, and it was a rotating general internship. And now, with the ambulances, you have these well-trained paramedics. We medical students didn't even know how to thread a needle, and we were the ambulance crew. And I can remember that my very first ambulance run there was on a Sunday morning, and we had an address in North Minneapolis. And if you would have asked me my name on the way there, I could not have told you my name. And I arrived at this house, and there were people outside, and there were police, and everybody was pointing in. And I dashed up. We carried a bag. I had forceps. I had morphine. We had everything you could find. A little portable hospital with us. And I rushed upstairs and went in the room. And immediately I relaxed because I could tell the woman was dead, and there was nothing I could do. So I was saved by the bell. But that was a hairy time.
And that was the old hospital on
In
5th
Minneapolis.
and Portland?
Yeah. We had big Cadillac ambulances.
And was there an emergency room?
Oh, yes. Very busy.
And were you on various rotations?
Yes. On every possible.
Okay. And what was the psychiatry part?
There was an annex building separate from the hospital, and there was locked in an open unit, and it's 3 units in, all over in there, yeah.
Was that Annex 4? Could you remember the?
I don't remember which floor it was, but it was the annex building that it was in.
And do you think that was a good preparation for what happened later?
I think so. If I ever reminisce, there are things I can flash back on that, arriving in. By the time you're there for a while, then you're a little more confident. And we really were faced with some real crucial decisions.
So it toughened you up, huh?
I think it wised me up.
Yeah, better word.
Yeah. One that sticks soundly in my mind is it would be like 2 and 3 in the morning, and this apartment in South Minneapolis, and this 15-year-old girl was laying on the floor in a pool of blood. She had delivered an infant, and I cut the cord and was concerned about her bleeding, so I started massaging the uterus. And I took the infant, wrapped it in a towel, and stuck it in my coat pocket. I thought it wasn't alive. And when I got back and was writing up a notes, I looked, and here, it's moving. And it was quite premature, so I rushed it off to the premature nursery, and it lived about 3 or 4 days. But I clearly think that that woman would have died. We had a couple times where we actually did something useful.
What was the most dramatic thing that happened during your time at Anoka State Hospital?
One of our young, who still calls me periodically, in the middle of the night had climbed the water tower, and he was up there, and he had a rifle with him. And someone said, "I think you better come out here." And I came out, and the Anoka police had a sharpshooter. They were ready to shoot him down. And I said, "No, I'll go up and get him." And I brought him down, and we're about 6 or 8 feet off the ground, and the police department dashes out with their guns, "Don't move." And I said, "No, you get out of here. I said I'd bring him down." So then they called the police chief himself, and the police chief came into the building, and he said, "Why don't you have him step outside, and we'll jump him?" And I said, "No. Well, he has to go to jail." I said, "Okay, I'll bring him. What time do you want him in jail?" And the police department was really furious that I was now billed as a totally uncooperative type. But I delivered him to jail at 8 o'clock, and he appeared in court by 10:30 and was sentenced to 2 weeks in jail. Talk about justice being swift. And he still chuckles about this water tower instance.
Can you say more about how you have maintained contact with former patients?
There's a few I exchanged emails with. Like when Larry came up, he's visited. He's stopped in a couple times to visit, and occasionally son will call.
And how do they view their time at Anoka or their treatment?
I think pretty positively.
Any other connections with Anoka State Hospital?
No.
How many people do you stay in contact with altogether, would you say?
Oh, it's probably no more than 8 or 10.
And they're from your time at Anoka State?
Yeah.
So they're getting to be older now.
Yeah, they don't look like kids anymore.
Okay, I think that's about all the questions that come to mind. Any final thoughts?
No,
Well, thank you so much for coming all the way from Duluth
my pleasure.
and sharing your memories. Thanks for all your years of service.
Mm-hmm.